Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon, and today I'm going to talk to you about ear infections. I specifically want to talk about middle ear infections, or what you might have heard of as acute otitis media. So these are ear infections that occur behind the eardrum. Theoretically, your eustachian tube, which drains into the back of your nose, is what's going to keep the pressure behind your eardrum the same as the pressure outside your eardrum. But when it fails to do that and fluid collects, sometimes that fluid sits as sterile fluid, which can be called otitis media with effusion, or it can become infected, in which case you have an acute otitis media. So acute otitis media, often kids will have pain and fever. They can be very fussy and clingy and cranky. They often will pull and tug on their ears. They typically do not like to lie flat at night and will have very poor sleep, and sometimes they even don't like to eat as much. So otitis media is typically treated by the pediatricians with antibiotics, and often we don't see it in our offices as ENTs until it's something that has become a persistent problem. So when I think about the number of ear infections, before I would think something like ear tubes would be required, I usually think about 3 in 6 months or 4 in a year. There are modifying factors. Sometimes we'll see patients who have not had quite as many, but have been on a myriad of antibiotics or having ear infections that won't clear despite antibiotics, or are having complications of otitis media that will require intervention lower than that number. Parents will often come to me confused because they were told their child has fluid behind their eardrums, but it's not infected. And so that is that otitis media with effusion. The first thing I want to say is that as a parent, you did not cause that by getting water in their ears in the bathtub. So for a child with an intact eardrum, you could pour water in their ear all day and it's not going to get into their middle ear space. And so that is not something that parents cause. Children get acute otitis media just because their heads are smaller and their eustachian tubes don't work as well. Sometimes because they have a lot of germ exposure to immature immune systems in places like daycare, things that can be risk factors, or things like prolonged bottle or pacifier use or smoking in the home, but definitely not getting water in the ears. So when fluid is sitting there, fluid is not necessarily a problem on its own. It's a problem in certain specific circumstances. So fluid with associated hearing loss from conductive hearing loss is a problem because kids are, in their prime speech and language development, and so we want to make sure they're hearing to their full potential so they can develop their speech to their full potential. There are also kids who are at higher risk for language delays, so kids who have developmental delays already have a known hearing loss other than the fluid, have known speech and language delays, have known conditions like autism spectrum disorder, known craniofacial anomalies like Down syndrome or other syndromes where their shape of the back of their nose and their ears is different than other children's, or kids with other sensory disabilities such as blindness or decreased vision. We have to be even more vigilant about middle ear fluid and its potential effect on hearing and development. And so children with long-standing fluid with those conditions or with hearing loss on an audiogram would also be candidates for ear tubes. In summary, kind of the two big reasons we think about ear tubes are persistent middle ear fluid with underlying conditions that predispose to speech delay, or middle ear fluid with hearing loss, or ear infections that are simply too frequent, or perhaps ones that aren't responding to antibiotics or are showing other complications. So in my next video, I'm going to talk to you about everything you always wanted to know about ear tubes but were afraid to ask. If you have suggestions for topics, feel free to drop them in the comments and I will do my best to get to them. And please subscribe to Dr. Nicole Knows. Thank you so much for watching.